Good
you're
to
good.
go.
Okay.
Sit, stand.
Sure. Hey everyone, it is Dr. Bird with Chiro Movement Muscle and Joint Clinic. Today I have with me Cecily. She is a coach or trainer here at our Inside Big Mountain Barbell. She really knows her stuff, but I'm having her help me with one orthopedic test of the hips. This one is called the Craig's test. It is to help determine if you have an anteverted or retroverted hip position on the pelvis itself. So to do this test, she's going to lay face down. What we're doing is we want to see, we're testing that hip position itself. So we're going to do this with a little bit of motion. So we're bringing that knee up into a 90-degree position, and you start to palpate the outside, palpating for the greater trochanter on the outside of the hip, of the femur, and you're looking for where it is at its most lateral. So I'm going to start by pulling that leg out into, or putting the hip into internal rotation. So our greater trochanter is right here. We're testing for where it is most lateral. And if we're being honest, it's right there. But we'll do a retest. Keep that hand right where it's at. So as you see, she has more of a internally rotated hip position where the greater trochanter is on the femur. That position would indicate that she has more of an anteverted hip position. If we were here with more of an externally rotated position and that greater trochanter was here, that would determine that she's more of a retroverted hip position. All that really means is where the acetabulum sits on the pelvis. On this video, one of the things I wanted to make sure that we talked about is the acetabulum, because it was apparent to me after Cecily talked to me. She said, you may need to describe some of these things. So totally fine, not a problem on my end. I just want to make sure that you understand when I'm talking about the femur position on the pelvis, what that actually means. So I have with me my spine model. It's as fancy as it gets, right? So this would be, that is a beautiful little pelvis right here. What you see here, that is what's called the acetabulum. Now we're talking about the position that acetabulum with the head of the femur, where it sits. When I'm talking about an anteverted position, that would mean that this would be more either angled more forward, so the femur actually heads out this way, or more posterior, where it actually points out this way. Again, if we're talking about anteverted position, we're going to gain, or we have more internal rotation of the hip. If we're talking about the back position or the retroverted position, the legs, the femurs, and the hips, they actually move better into external rotation. So that may make some difference for certain people. It may cause irritation if they're trying to do a squat, but their hips are better yet, or if they're trying to do a squat with a straight leg position, or knees pointed forward, toes pointed forward, and they don't have the range of motion to do it, that might actually irritate something. So soft tissue wise, or the actual bone is just crushing into it, or their just movement patterns alone look different. So this is why we use that Craig test. We want to make sure that the position you're getting into makes sense for your hips, because if it doesn't, we can adapt to it. We have tons of different ways to vary workouts or vary exercises that keep you out of my office, basically. If it's more forward, or if it's positioned more on the backside. So that can determine how your hips move and how you might change up some of your exercises that you do in the gym itself. And it might even tell us why certain hip positions of squat or deadlift start to irritate your hips. So this is one of the orthopedic tests that we use. Again, that is it. So yeah, you can contact me through chiromovement.com. 801-251-6658 is the phone number, and we are in Midvale, Utah, inside Big Mountain Barbell Gym. Great, thank you.